Hi, my name is Flower Lewis, and I am currently a registered nurse in the ICU, and I'm going to be teaching you first aid in choking. Some of the skills we're going to be going through today are checking an unconscious victim, conscious choking, and how to control bleeding. We will also go through some cardiac and respiratory emergencies. Let's watch our first introductory video.
Somebody's not happy with lunch.
Yeah, he should have gone to the Shook Shack.
Get that email from Natalie?
The one about the cats?
Yeah. What was that?
Do you think he needs help?
You know, no. It's probably nothing.
I don't know, Steve. He might have a serious medical problem.
Nina, it's not our problem.
I'm going to check it out.
Come on, Nina, don't.
Sir?
I hope you know what you're doing. You might get sued. You realize that?
Is everything okay here?
Something's wrong with this man.
I'll get a first aid kit and call security. Security?
That guy must be drunk.
I'm Nina. I have training in first aid. Is it okay if I help you? Can you tell me what happened? Can you tell me your name? Sir? He has diabetes. We need to get him help right away.
Can you tell me what happened here?
He suddenly fell over. His medical ID says that he has diabetes. I think he needs help.
Okay, I'll call 911. Security officer one from food court. Yep.
Okay, now, what were some of the roles we saw in that video? There weren't very many. We had the person with their head slumped over. We would call them the victim. And then we had the person who was willing to help. We would call them sort of like the caregiver. And then we had the person who got on the walkie-talkie. We would call that sort of like the first responder. So these roles are going to be used throughout the entire course. Now let's talk about why people chose not to act in that video. What did they say? Afraid of being sued, scared, not knowing what to do, things of that nature. Now, do you think that the caregiver needed to ask permission to give that guy care? The answer is absolutely yes. If they are conscious, you ask permission to give them care. If they say no, you say, hey man, if you want to bleed to death, no problem with me, I'll call 911 for you. Now, what do you do if they're unconscious? You give care because you assume they cannot help themselves. Now let's talk about the child. What if a child needs help? What do? First, you ask the parent. If there is no parent around, you would give care again, assuming they cannot help themselves. And of course, if they're unconscious, you would immediately give care. Now, have any of you heard of the Good Samaritan law? This is a law put into place to protect people who voluntarily give care, within their scope of practice, of course. So just know that you will not be sued if you voluntarily give care to someone within your scope of practice. We're going to go to our first skills checkoff here. It's going to be checking an unconscious victim.
When you find a person who appears to be unconscious, follow the emergency action steps. Check, call, care. Check the scene for safety. For a child, obtain consent from a parent or guardian if present. Then check the person for responsiveness. If the person doesn't respond, call for help. If the person is face down, gently roll the person face up, keeping the head, neck, and back in a straight line so you can provide care. Once the person is on her back, open the airway by using the head tilt, chin lift technique. To perform the head tilt, chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back as you lift up on the chin. Maintain this position. For a child, do not tilt the head back as far as you would for an adult. Check for breathing for no more than 10 seconds. Look to see if the person's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. In an unconscious adult, you may detect an irregular, gasping, or shallow breath. This is known as an agonal breath. Do not confuse this with effective breathing. Care for the person as if there is no breathing at all. If an adult is not breathing, quickly check for severe bleeding, then begin chest compressions. If a child is not breathing, give 2 rescue breaths, one after the other, before checking for bleeding and giving care for the conditions you find. Use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the child's mouth. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the child's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If at any time an unconscious person begins vomiting, the airway could become blocked. Roll the person onto one side, and then use a finger to clear out the mouth. Once the mouth is clear, continue to provide care based on the conditions you find. If the person is unconscious but breathing, maintain an open airway with the head tilt, chin lift technique, and monitor breathing and for any changes in condition until EMS personnel take over. If you cannot maintain an open and clear airway because of fluids or vomit, place the person in a modified Haynes recovery position by moving the person to her side while keeping the head, neck, and back in a straight line with the knees bent. If you need to leave the scene to call 911, modify this position by tucking the hand under the head.
Now we're going to follow the emergency action steps to check, call, and care to assess our victim. When we first see our victim, we're going to assess the scene, see if it's safe. This means if she is in the middle of the street and a car is coming, we're not going to get hit by a car. You need to make sure you protect yourself first. So I check the scene is safe. Next, you need to check the victim. Ma'am, are you okay? She's not okay, so now we're going to call 911. Make sure you look at someone and point to them so they know it's their job to call 911. After we do that, we're going to need to care for the individual appropriately. We're going to take her arm, and whichever way we decide to turn them, that arm should be in the air. Okay, so I'm going to turn her this way, guide her by her shoulder and her hips, and turn her over. Next step is to assess breathing. We do this by doing a slight head tilt chin lift, get down, and listen for no more than 10 seconds. So you basically look, listen, and feel for breathing. Okay, she's breathing. Then we're going to scan the body for any blood. I don't see any blood here. Oh no, she's throwing up. Turn the victim over. Again, making sure that arm is in the air. Take your gloved finger, scoop out their mouth. Ma'am, I'm going to need to leave you. You're going to want to take their arm and put it underneath their chin and bend their legs up sort of as a little stabilizer. And then you can leave the scene to go and get something for emergency personnel. So now we're going to talk a little bit about cardiac emergencies and some signals and symptoms of a heart attack. The first one being the universal sign, which would be clenching your chest. If you see anybody doing this, call 911 immediately. Another signal of a heart attack would be any sort of left-sided pain, numbness, or tingling. It usually starts in the arm and radiates upward to either the jaw or the chest area. It can also be in the left-sided flank or back. Unconsciousness, a pretty good sign that someone's having some sort of cardiac emergency. Call 911 immediately. Indigestion, some people think they have some sort of heartburn, especially women. So if someone is having this, you'd say, hey man, do you need some help? Pale, sweaty skin almost always happens, profusely sweating. Breathing difficulties could be a sign of a or a signal of a heart attack as well. Now, the feeling of impending doom is when someone gives you a look, you know, their eyes are wide open, or they're sitting there and they say, I need to get to the hospital now. Chest pain that doesn't go away after 3 nitroglycerin tabs is considered a real heart attack. Now, chest pain, also called angina, not relating to a heart attack, will go away if you take these nitro tabs. If the pain doesn't go away, it is a real heart attack. Call 911. And denial is also considered a sign of a heart attack. This is when you have like 2 guys standing on a dock and one is all slumped over telling the other, and the other guy is saying, hey man, you don't look so good. And the guy who's slumped over, profusely sweating, is saying, no man, I'm fine. So denial is considered a real sign of a heart attack. We're going to go ahead and watch a video on cardiac emergencies now.
I'm Rich Fellner.
I'm Brenda Beasley.
My name is Cherie Brackett.
My name is Thomas Beasley.
First symptom was severe indigestion, which was not fixed by an antacid.
First thing was the chest pain. I noticed that almost immediately. It was very uncomfortable. Felt like somebody was standing on my chest.
Seemed like it was getting tighter, like a fist was in there. It was like something was just crushing it.
Then came profuse sweating just out of nowhere.
Pain radiated right up into my jaw, and then down into my arm and fingertips.
And all of a sudden, you can't breathe, and you start sweating, and your chest started hurting. Something's wrong.
Then a sense of doom that the whole world was coming to an end.
Was very scared, had decided that it was time to tell my wife. It was time to go to the hospital and, see if it was, in fact, what I feared, which was a heart attack.
I told my wife, I have never felt this way, and I was serious when I told her this too. I said, it's time to go. She probably looked at my face and said, he's not playing.
He was sweating, and things that he never did before that made me know something was wrong.
It's important to know what to do when someone that you love becomes pale or sweaty and has chest pains.
It can happen to anybody, and it can happen overnight. It can happen in the blink of an eye. I'm just very glad to be here telling the story, and that I knew what to look for.
Sometimes I get a little emotional. When I talk about it, it's not usually a tear drop out of my eye, because this was real serious.
So I immediately got help. I went to someone at the front of the store and asked them to call 911 for me. And within 15 minutes, I was in the hospital emergency room being treated for a heart attack.
Because it can happen at any time and anywhere, and you just don't know when it's going to happen.
I'm glad to be here today.
He's my beat. He's my beat. And I love him. I love him a lot.
Cardiac emergencies are life-threatening. Heart attack and cardiac arrest are major causes of illness and death in the United States. Following the cardiac chain of survival by recognizing the signals of a cardiac emergency, calling 911 or the local emergency number and giving immediate care saves lives. Performing CPR and using an automated external defibrillator, or AED, immediately after a person goes into cardiac arrest can greatly increase his or her chance of survival.
Oh, Jada. Sandra, help. It's Jada.
Jada? Tony, bring me my bag, please. Jada, can you hear me? Jada? All right, looks like she's unconscious. Call 911.
There are 4 links in the cardiac chain of survival that guide any response to a cardiac emergency: early recognition and access to the emergency medical services system, early CPR, early defibrillation, and early advanced medical care. The first link in the cardiac chain of survival is early recognition and access to the EMS system. Recognizing a cardiac emergency and activating the emergency medical services system gets help on the way quickly. Early CPR is the second link in the cardiac chain of survival. Performing CPR keeps blood containing oxygen flowing to the brain and other vital organs. The third link in the cardiac chain of survival is early defibrillation. Early defibrillation from an automated external defibrillator, commonly called an AED, may help to establish an effective heart rhythm and significantly increase the patient's chance for survival.
Shock delivered.
Early advanced medical care is the fourth link in the cardiac chain of survival. Professional responders can provide the knowledge, equipment, and medications to continue the life-saving care you have already given. In a cardiac emergency, when every second counts, responding quickly using the 4 links in the cardiac chain of survival can mean the difference between life and death.
Welcome back, everyone. Let's get right into breathing emergencies. Let's talk about some signs and symptoms. First being slow or rapid breathing, deep or shallow breathing, any sort of wheezing, gurgling, or high-pitched noises, ashen or blue skin color, usually beginning in the fingertips and toes. When you're short on oxygen, basically the oxygen will protect your brain, heart, and lungs, and that's why you often see blue fingers, toes, lips before you see anything else. And dizziness or lightheadedness can also be considered a signal of a breathing emergency. Let's talk about some causes. Causes of breathing emergencies: choking, illness such as bronchitis or emphysema, things of that nature, asthma even. Electrocution can cause breathing emergencies. Smoke inhalation. Allergic reactions can cause a breathing emergency when the allergic reaction causes some sort of swelling of the mouth or tongue, occluding the airway. Drug overdoses can cause a breathing emergency, or rather stopping of breathing, really. Poisoning, non-fatal drowning, and panic attacks can also cause a breathing emergency. Now we're going to talk about the one on this list that is the biggest cause of breathing emergencies. Right, choking. What are some causes of choking? The food causes, the biggest one would be hot dogs. They're the perfect shape to occlude the airway, especially with toddlers, so do not give toddlers hot dogs, and if you're going to, cut them very small. Grapes are another big cause, more so for the elderly, so I know a lot of facilities out there actually cut the grapes in half for them. Carrots, popcorn, and gum can also be considered foods that easily cause choking. Non-food related items, I've seen baby powder cause choking or sort of a reaction in people before, along with bleach as well. Coins, marbles, and balls can also cause choking. Small toys and children, so make sure you keep these away from them. We're going to go ahead and watch our video on conscious choking and practice after.
When something is lodged in someone's throat, the natural response is to cough. If the person is coughing forcefully, he's getting air. Encourage him to keep coughing. If a conscious adult or child can no longer cough, speak, or breathe, he may be choking. Have someone call for help and obtain consent. A conscious adult or child who has a completely blocked airway needs immediate care. Using more than one technique is often necessary to dislodge an object and clear a person's airway. A combination of 5 back blows, followed by 5 abdominal thrusts, provides an effective way to clear the airway obstruction. To avoid injury, never give actual back blows or abdominal thrusts to someone who is not choking. These techniques are simulated for training purposes. Provide support by placing one arm diagonally across the chest. Bend the person forward at the waist so his upper airway is at least parallel to the ground. This will help ensure that the object will not go back down the person's throat. Using the heel of your other hand, give 5 firm back blows between the shoulder blades. If the 5 back blows do not clear the airway, give 5 abdominal thrusts. Standing behind the person, use 1 or 2 fingers of one hand to find the navel. Make a fist with your other hand and place the thumb side of your fist just above the navel, in the middle of the person's abdomen. Grab that fist with your other hand. Give 5 quick, upward thrusts. Continue to give 5 back blows and 5 abdominal thrusts until the object is dislodged, the person can cough forcefully, speak or breathe, or the person becomes unconscious. If the person becomes unconscious, gently lower him to the ground, protecting his head on the way down. You may need to kneel behind a child to give effective back blows and abdominal thrusts. Do not use as much force with a child.
Let's go ahead and get right into our conscious choking demo. We have our victim here, Ashley. Now, do I need to ask permission to give care? The answer is yes, I do. She's conscious. Go ahead and choke for me, Ashley. Thank you. Ma'am, you're choking. Can I help you? Okay. What you're going to want to do is bend them right in half, support in front, and take your hand and right between their shoulder blades, you're going to go 1, 2, 3, 4, 5. With a good amount of force, pick them up. Take your foot right in between theirs just in case they fall. Go 2 inches above the belly button and thrust up. 1, 2, 3, 4, 5. Bend them back over again. 1, 2, 3, 4, 5. And you're not going to stop until the object comes out, they cough forcefully, or they go unconscious. So now, with that being said, let's say you have a child in front of you who just ate a piece of candy. All of a sudden he has a scared look in his face, but he's coughing forcefully. What do you tell him to do? Keep coughing. And now we're going to go to our next video, recognizing sudden illness.
Determining how to help a person who becomes suddenly ill can be difficult. Some illnesses can strike with no warning, including fainting, seizure, stroke, diabetic emergency, allergic reactions, poisoning, and fever. Common signals of sudden illnesses include dizziness or unconsciousness, trouble breathing, signals of a heart attack such as chest pain, discomfort, or pressure that may spread to the shoulders, arm, neck, jaw, stomach, or back. Signals of a stroke, such as sudden weakness on one side of the body and sudden trouble with speaking or getting words out, loss of vision or blurred vision. Signals of shock, such as rapid breathing and ashen skin. Sweating, persistent abdominal pain or pressure, nausea or vomiting, diarrhea, or seizures. Certain sudden illnesses require specific care. In general, to help a person experiencing a sudden illness, do no further harm. Monitor breathing and consciousness. Help the person rest comfortably. Keep the person from getting chilled or overheated. Reassure the person. And give any specific care needed. Call 911 or the local emergency number for the following conditions: unconsciousness or altered levels of consciousness, trouble breathing or no breathing, signals of a heart attack, persistent abdominal pain or pressure, severe external bleeding, vomiting blood or passing blood, severe or critical burns, suspected poisoning, seizures, stroke, suspected or obvious injuries to the head, neck, or spine, or painful, swollen, deformed areas, or an open fracture. A seizure is the result of abnormal electrical activity in the brain that causes temporary, involuntary changes in body movement, function, sensation, and awareness or behavior. Most seizures last only a few minutes and can include the following signals: a blank stare, a period of distorted sensation during which the person is unable to respond, uncontrollable muscular contractions called convulsions. Call 911 or the local emergency number if the seizure lasts more than 5 minutes. The person has multiple seizures with no signs of slowing down. The person appears to be injured or fails to regain consciousness after the seizure. The cause of the seizure is unknown. The person is pregnant. The person has diabetes. The person is a young child or an infant who experienced a febrile seizure. The seizure takes place in the water. The person is elderly and could have suffered a stroke. Or the person has no known history of epilepsy or seizures. If a person is actively seizing, remove nearby objects that could cause injury, protect the person's airway, and allow the seizure to run its course. Attempting to stop a seizure or restrain the person can cause injuries. Do not place objects or fingers into the mouth of an actively seizing person. Recovering from a seizure usually takes just a few minutes. The person may be disoriented and drowsy. Reassure the person as you monitor his condition.
What's your name?
A fever occurs when a person's body temperature is higher than 100.4 degrees Fahrenheit. Fevers are common in children and infants. Signals of fever include skin that is hot to the touch, chills and body aches, headache, trouble sleeping or oversleeping, drowsiness, and lack of appetite. Additional signals for infants include being fussy and crying, becoming listless, and rapid breathing. Young children and infants with a fever over 103 degrees Fahrenheit can experience a heat-induced seizure called a febrile seizure, lasting less than 5 minutes. Febrile seizures are not usually life-threatening and produce different signals, which include a sudden rise in body temperature, change in the level of consciousness, rhythmic jerking of the head and limbs, confusion, drowsiness, crying out, becoming rigid, holding his or her breath, an upward rolling of the eyes. Call 911 or the local emergency number if the child or infant with a fever has signals of a life-threatening condition, such as unconsciousness or trouble breathing. For a child who has experienced a febrile seizure, call 911 if it's the child's first seizure, or if the seizure lasts longer than 5 minutes, is repeated, or is followed by a quick rise in temperature. Infants younger than 3 months with any fever and children less than 2 years with a high fever greater than 103 degrees Fahrenheit require immediate evaluation by a healthcare provider. If the child or infant has a fever, make him as comfortable as possible. Encourage rest and make sure he drinks plenty of clear fluids. If the child has a high fever, gently cool him. Never rush cooling down a child. If the child experienced a febrile seizure, rapid cooling could bring on other complications. Remove excess clothing or blankets and give him a sponge bath in lukewarm water. Comfort him as you monitor for changes in his condition. Before giving a child any medication such as acetaminophen, contact a healthcare provider. Do not give aspirin to infants or children under 18 years old. Aspirin has been linked to Reye's syndrome, a serious medical condition that affects the brain and other internal organs. A stroke or brain attack occurs when blood flow is blocked from reaching part of the brain. A stroke can cause permanent damage to the brain if not treated soon after the onset of signals. A person experiencing a stroke needs immediate medical attention. When a person is suffering a stroke, she can experience weakness or numbness of the face, arms, or legs, severe unexplained headache, facial droop or drooling, difficulty speaking or comprehending, vision loss or disturbance in one or both eyes, dizziness, confusion, agitation, loss of consciousness or other severely altered mental status, loss of balance or coordination, trouble walking, or incontinence. For a stroke, think fast. Face, arm, speech, time. F stands for face. Ask the person to smile, then check to see if one side of her face droops. A is for arm. Ask the person to raise both arms to check for weakness or numbness in one arm. Watch for one arm to drift down. S means speech. Ask the person to repeat a simple sentence. Is the person slurring the words or able to repeat the sentence correctly? T stands for time. Make note of the time the signals first appeared. If the person shows any signs of a stroke, call 911 or the local emergency number right away. Care for any conditions that you find until EMS personnel take over. Reassure the person and have her rest comfortably. Do not give her anything to eat or drink. Continue to monitor the person and note any changes in her condition. Relay all the information to EMS personnel when they take over.
let's talk a little bit more about stroke, which is a blockage of blood flow to the brain. Do you guys remember the acronym FAST? F stands for face. Tell them to give you a simple smile. See if one side droops. A stands for arm. Have them lift both arms. See if one drifts down. Speech. Tell them to repeat a simple sentence. See if they slur their words, or they can even say a completely different sentence. And time. Time stands for make sure you alert emergency personnel to the exact time that the symptoms started. Why? Because there's a medication that they can get in the hospital within 4 hours of when the symptoms began that can drastically reduce what has just happened to them. Now, let's talk a little bit about bleeding and controlling bleeding. We're going to watch a short video where two kids are playing and something happens to them, and we're going to see how we're going to need to handle that situation.
Mom, we're going over there.
Careful, you guys. So what's cooking today?
Well, let's see. Same thing as yesterday.
Come on, I'll give you a ride.
So I was thinking we take those rocks and we push them a little closer to the street over there.
Yeah, that's a good idea.
Mom! Come quick! Jeremy's hurt!
Get the first aid kit and get some ice too.
Jeremy, you're bleeding and I don't have anything.
Okay. Oh, well, we're trained in first aid. I'm Eddie and this is Felix. Can we help?
Yes, please.
Okay.
Eddie's gonna help you, okay, honey?
Yeah.
Casey, are you okay?
Yeah, I think so.
Hey, mind if I take a look?
Felix is gonna help you, okay, honey?
Let me put this ice pack on.
All right, buddy. I'm just gonna put a little pressure on it just to stop the bleeding, okay?
Just hold on to my hand.
Coming out of that video, we had Casey, the girl, who sustained an abrasion or a scrape, and Jeremy, the boy, who sustained a laceration or a cut. Caring for these open wounds is almost always the same. You're going to want to put pressure, add a gauze, and then wrap it in a bandage. If it continues to bleed, you wrap it in more bandage. You do not remove the original ones. We're going to go ahead and watch the video on controlling external bleeding.
When a person's skin is broken and bleeding, she has an open wound. Most open wounds will stop bleeding on their own after a few minutes. In cases of severe bleeding, have someone call 911 or the local emergency number immediately. Check the scene for safety. Obtain consent to give care. Check the person. Follow standard precautions, including gloves and other personal protective equipment when providing care. Cover the wound with a sterile dressing or clean cloth. Apply pressure on the wound until the bleeding stops. Wrap a roller bandage around the dressing to secure it in place and keep pressure on the wound. Start from the end farthest from the heart. Overlap the roller bandage several times to completely cover the dressing. Tape or tie off the end of the bandage to keep it in place and keep pressure on the wound. If bleeding does not stop, do not remove the blood-soaked bandages and dressings. Apply additional dressings and bandages and continue to apply pressure. Do not attempt to wash or clean a severely bleeding wound. Your first priority is to control the bleeding. Take steps to minimize shock and call 911 or the local emergency number if you haven't already done so. In cases where an object is embedded or impaled in a person's skin, caring for the wound is slightly different. Do not remove the object. Removing it may cause more damage. Keep the object and the body part still. Place gauze dressings around the object. Lightly press the area around the wound, but do not press on or move the object. Surround the object with bulky dressings to keep it from moving. Carefully wrap a roller bandage over the dressings and around the object, but do not cover the object itself. Overlap the bandage until the dressings and object are completely secure, then tie or tape the bandage in place. Monitor the person's condition until a trained responder or EMS personnel take over. If bleeding continues, apply more bandages and maintain pressure.
We're going to go ahead and get right into our controlling external bleeding demo. Ma'am, you look like you're bleeding. Can I help you? We're going to want to start off by putting on our gloves so we can make sure we protect ourselves. Next step you're going to want to do is you're going to want to grab your gauze and put pressure right over that wound. A good 5 minutes is generally a good amount of time to control the bleeding and get the clotting factors in the area. Then you're going to want to take your roller bandage, still holding pressure over the bleeding area, and start wrapping it around. It's probably a good idea to wrap it towards the heart so you can decrease the amount of blood flow to the area and therefore decrease the amount of bleeding. You want to wrap it tight enough so that the bleeding stops, but not too tight as to cut off circulation. And to finish up, you're just going to want to tie the end of the gauze right around the bleeding area to hold a little extra pressure there, or you can put a piece of tape. So to check circulation, we're going to want to look at the fingertips. I'm going to push down and see that it goes white. When I let go, it's going to return to a nice pink color. You can also ask the victim, does that feel too tight? No. Good. Also, make sure you check the wound. If it starts bleeding again, make sure you add more bandage. Never remove the original bandage. In summary, for first aid and choking, I'd like you guys to come away with this point. Call 911 immediately in an emergency. I'd like to thank you guys for being with me today and hope to see you real soon.